My name is Paul Sethi. I'm an orthopedic sports medicine surgeon in Greenwich, Connecticut. Anterior cruciate ligament tears can be devastating injuries. While most athletes who undergo surgical reconstruction can expect to play sports at a high level, our focus today is on the prevention of these injuries. The video and the exercises that we will present today are based on the work from the Santa Monica Orthopedic Group and their PEP program, as well as Dr. Timothy Hewitt and his program in Cincinnati. Today you'll see Katie DeAndrea, a high school athlete who tore both of her ACLs and had reconstruction on both sides, Jake Longo, a high school athlete who tore his ACL twice in the same knee, and Peter Phillip, an experienced physical therapist with a wealth of information about ACL prevention and rehabilitation. It is our hope that you'll watch this video carefully, learn the exercises, and incorporate them into your daily routine so that you can avoid an ACL injury.
Warming up and cooling down are a crucial part of a training program. The purpose of a warm-up section is to allow the athlete to prepare for activity. By warming up your muscles first, you greatly reduced the risk of injury. Jogging line to line. The purpose is to allow the athlete to slowly prepare themselves for a training session while minimizing the risk of injury. We will be educating the athletes on a good running technique. The hip, knee, and ankle should maintain straight alignment without the knee caving in or the feet whipping out and around the side. The instructions to your athlete would be to complete a slow jog from one point to the other point. Shuttle run. Start in an athletic stance with a slight bend at the knee. Lead with the right foot, sidestepping, pushing off with the left foot. While you drive off with the back leg, be sure that the hip, knee, and ankle are in a straight line. The shuttle run can also be utilized as an agility drill. Set up 4 cones. Have your athlete start at the first cone, lightly jog towards the first cone, plant a foot as they push to come back to the starting cone. When they come to the starting cone, they should push off that, plant the foot, push firmly into the ground, and move towards the second cone. When they reach the second cone, they should plant their downside foot, returning back to the beginning, and repeat until all cones have been met in this sequence. Backwards running. The purpose is for continued progressive warm-up while engaging the hip extensors, also known as the hamstrings. Make sure that the athlete lands on his or her toes. Be sure to watch for locking of the knee joint. As the athlete brings his or her foot back, make sure that he or she maintains a slight bend in the knee. The calf stretch. Purpose is to stretch the calf musculature of the lower leg. Instruction to the athlete. Stand leading with your right leg. Bend forward at the waist and place your hands on the ground, forming a V with your body. Keeping your right knee slightly bent and your left leg straight. Make sure that your left foot is comfortably resting on the ground, reaching for the toes until a gentle stretch is felt. Quadricep stretch. The purpose is to stretch the quadricep muscle of the front of the thigh. Instruction to the athlete. Place your left hand on your partner's shoulder. Reach back with your right hand and grab the front of your right ankle. Bring the heel towards the buttock. Make sure your knee is pointed down towards the ground, keeping both knees together. Do not allow the knee to wing out to the side, and do not bend at the waist. Hamstring stretch. The purpose is to stretch the hamstring muscle of the back of the thigh. Instruction to the athlete. Sit on the ground with your right leg extended in front of you and your left foot curled into the thigh, bent at the knee. With a straight back, try to bring your chest towards the knee. Do not round your back. If possible, reach your hands down towards the toes and pull them up towards the head. Otherwise, place 2 hands above the knee, and lift your chest forward. Inner thigh stretch. Purpose is to elongate the muscles of the inner thigh, the adductor group. Instruction to the athlete. Remain seated on the ground. Spread your legs evenly apart. Slowly lower yourself to the center with a straight back. You want to feel a stretch in the inner thigh. Hip flexor stretch. The purpose is to elongate the hip flexors of the front of the thigh. Instruction to athlete. Lunge forward, leading with your right leg. Drop your left knee down to the ground. Place your hands on top of your right thigh and lean forward with your hips. Walking lunges. The purpose is to strengthen the thigh, hamstring, and gluteal muscles. Instruction to the athlete. Lunge forward, leading with your right leg. Push off with your right leg and lunge forward with your left leg. Drop the back knee straight down. Make sure that you keep your front knee over your ankle, controlling the motion so that your ear, shoulder, and hip move in a perpendicular line towards the ground. Do not allow the spine to sway. Always maintain a light degree of contraction in your abdominal muscles. Russian hamstrings. Purpose is to strengthen the hamstring musculature. Instruction to the athletes. Kneel on the ground with your hands at your hips. Have a partner hold you firmly at your ankles. With a neutral spine, abdomen tight, chest up, lean forward with your hips. Single toe raise. The purpose of this exercise is to strengthen the calf musculature and to increase balance. Instruction to the athlete. Stand with your arms at your side or your hands on your hips. Bend the left knee so that the two knees are parallel. Maintain your balance. Slowly rise up on your right toes while maintaining abdominal tension so as not to fall. Lateral hops over cone. Purpose is to increase power and strength, emphasizing neuromuscular control. Instruction to the athlete. Stand with a cone to your left. With both feet comfortably below you, hop over this cone, softly landing on the balls of your feet. And during your landing, you want to absorb body weight until you explode back up and over the cone, repeating to and fro. Forward and backwards hopping. The purpose is to increase power, strength, emphasizing neuromuscular control. The instruction to the athlete. Stand facing a cone with your feet comfortably underneath you. Pull yourself into a squatting position, explode up and over the cone, softly landing on the balls of your feet, allowing your body weight to be absorbed, first through the ankle, knee, then hip, all the while moving, exploding, but then back up, over the cone, and repeating. Repeat 20 times. Single leg hops over cone. Purpose, to increase power, strength, emphasizing neuromuscular control. Instruction to the athlete. Hop over the cone, landing on the ball of your foot, bending at the ankle, knee, and hip. Repeat to and fro, left to right, all the while maintaining fluidity of movement. Repeat this 20 times. Vertical jumps with sport-specific activity. The purpose is to increase height of a vertical jump while replicating sport-specific movements. The instruction to the athlete. Stand forward with their hands at their side. Slightly bent knees. Ask them to jump as high as they comfortably can, straight up. As they are jumping, a sport-specific movement should be introduced. This can include tossing of a soccer ball for a header, tossing of a football for a catch. The athlete should be challenged in a progressive fashion. Scissor jump. Purpose is to increase power and strength of the vertical jump. Instruction to the athlete. Have the athlete lunge left foot forward. As they slowly lower their right knee towards the floor, have them explode up, switching their legs in midair, landing with the right foot forward, left leg back, slowly lowering themselves towards the floor and then exploding back up. Squatting. Purpose: to increase strength of the hip, spinal erectors, abdominals, hamstrings, thighs, and deep calf muscle. Instruction to the athlete: stand with your feet comfortably, shoulders width apart, toes pointed out 10 degrees. Arms should be cross-chest. Hips backwards as if they were sitting into a chair. Abdomen tight. Lunges. Instruction to athlete: have them stand with their left foot forward, right foot back in a long stride position. The right foot should be firmly planted on the toes, heel up, left foot flat and comfortable. Arms hanging to the side. The athlete is to maintain their ear, shoulder, hip in one straight line perpendicular to the floor. Heel raises with hip abduction and internal rotation. Instruction to athlete: have the athlete stand with their feet comfortably wide apart. Toes maximally turned in. Have the knees straight at all times. Tension through the abdomen. Both hands are to be placed at their hips. Diagonal runs. Instruction: have the athlete facing forward, running at an angle. Make sure that the outside leg does not cave in, keeping a slight bend in the knees at all times. Bounding run. Instruction to the athlete: starting at the sideline, run to the far side with an explosive knee flexion moment, gliding through the air in a gazelle-like fashion. Unilateral bridges. Instruction to the athlete: lie on the ground with both knees bent, arms cross-chest. Have the athlete place their right foot on left knee. Maintaining abdominal tension, they are to raise the hips from the floor, holding in a comfortable position for 3 seconds, and then slowly lowering halfway down and repeating 20 times. Peters 20. Instruction to the athlete: have the athlete lie on the ground, head flat, shoulders flat, arms resting along their sides. Have the athlete bring their legs so that they are 90 degrees to the torso. Ask the athlete to firmly plant their arms, shoulders, and neck into the ground as they raise their tailbone, their hips, up towards the ceiling. Standard abdominal crunches. Have the athlete lie on their back, knees comfortably bent. Hands placed under the neck and head with the fingers interlaced. Elbows are to be held off to the side. The athlete is asked to raise their shoulder blades from the floor, hold comfortably for 1 to 3 seconds, and slowly lower down. Obliques. The athlete is asked to lie on their back, knees flexed to comfort, both hands underneath their neck and head, fingers interlaced. The athlete is asked to bring both knees slightly to the left, with their left elbow pointing skyward. Lower abdominal crunch. Athletes are asked to maintain their hands at their neck and head, fingers interlaced. Knees are to be bent and feet are to be held off of the floor. As the athlete holds this position, they are asked to raise their shoulder blades and hip for 1 second, then slowly lower down. Their tailbone and shoulder blades are never to come to a complete rest. Single and double knee to chest. Instruction to the athlete: lie on your back, bring the right knee towards the chest, and hug firmly, pulling the knee upwards and out. Seated butterfly stretch. Instruction to the athlete: sit up, bringing your feet in so the soles of your feet are touching. Gently place your elbows on your knees and slowly push down.
Tearing my ACL had a major impact on me as a high school athlete because it ruined my recruiting career. All my life I wanted to play lacrosse in college, and since the end of freshman year, I was really serious about it, and I was doing all these summer camps. I was playing on this MULAX team, and when I tore my ACL, I was unable to play my sophomore year of high school, which wasn't bad. It wasn't the worst thing that would ever happen to me, but it was still a disadvantage. And then I tore it again over the winter, and I missed my junior year, which is like the prime recruiting year. Being like injured has made me put my career as an athlete on hold, while my other teammates have improved and gotten the chance to play and get the experience. Well, I've just sat there for like a month or a year and a half and haven't done anything to improve my skills and to improve my ability in sports.
Tearing my ACL had a major impact on me because I really enjoyed playing football, and that was why I moved to Greenwich basically for. It also affected my schoolwork because I became very depressed, and I just didn't want to do anything because I thought that, man, I tore my ACL, everything is over. So some of the side effects of tearing my ACL was depression. I was always in bed sleeping, wasn't hanging out with my family. I went through about 10 months of therapy and a lot of pain to get my knee better, and it doesn't seem like it impacts your life, but it really does, because you can't walk really. After the surgery, you can't walk, and you have to work hard. You have to have strong willpower to get your leg back so you can walk.